Welcome to Healthcare for All, Washington's second Wednesday speaker series. I'm Ronnie Shure. I volunteer as the president of Healthcare for All Washington. And tonight we'll be sharing our legislative agenda for 2024. We're going to walk you through an overview of the legislative session that's coming up. Our lobbyist will tell you some of the details about three big provisos that are our highest level of support. Then we'll talk to you, we'll bring out all of our volunteers from our policy committee who will be talking about the Take Action Network, which we use to send messages about hearings that are coming up. We will bring out another volunteer to give some of her perspective on personalizing your message when you reach out to legislators. And then we'll talk about specific bills that different groups have been putting forward and our take and our level of support for several of those bills. And then we will be gathering some questions and answers. And one of our volunteers, Chelo Echeverria, will be watching in the chat for those questions and answers. So after the program is complete, then we'll come back and answer as many of those questions as we can. We will stop at 8 o'clock just out of respect for each of you, but we will bring answers. If you do enter something in the chat, make sure you give us an email if you're new to Healthcare for All, an email address so we can get back to you with that answer. So in case we run out of time. So I volunteer, you too can volunteer. If you look in the chat, you'll see a link to go to our website to make a donation. It really helps us in our lobbying efforts and in supplies and in staff to maintain our website and keep that information coming out to you. So go to that website, make a donation if you're able, and there's a place where you can hit the volunteer button as well as the donate button. But volunteer to join one of our committees or to work on a specific action. So please get involved. Watch for that website to show up during the course of the meeting. We've set a goal to raise $300 during our program tonight. So if you are able, please, you can make a donation online. I also mentioned that the chat will have an opportunity to enter your questions and feel free to enter them anytime as we're going along. We will be monitoring it, adding and entering it at the end. We also have made transcription or closed captioning available. So if you go down to the bottom of your screen and just hover over that particular closed captioning icon, you can automatically bring up some of the comments that we're making tonight. So we're going to start with one board member, Denny Dellwo, who was a former legislator from Eastern Washington. And he will start out by giving us an overview of the legislative session. We will then switch to our lobbyist, Lonnie Johns-Brown, who will talk about three big issues, budget issues that we will be supporting with all of our effort and have been working on for months and months and months already. And then we'll go to Ron Lovell, another volunteer, who will talk about introduce you to the Take Action Network, a program you can sign up with that can give you messages about the details of how to use the information that Denny and Lonnie will be providing you. Then Chelo Echeverria, another volunteer who's a member, and each of these volunteers happen to be, so far, are members of our board of directors. So you can volunteer at different levels. as then we'll bring on a group of our policy committee volunteers, some of whom are on board, some are not on our board, just participate in a community or in a committee. So there are a lot of different ways to get involved. So we'll bring on those volunteers to talk about the different bills that we are supporting and hope you will support this year also. And then while Chelo is coming back to gather questions that you put into the chat, we will bring in our treasurer, Peter Lucas, from our board of directors, who will offer you some details on donating. So even if you don't click in early, we'll give you the opportunity at that point to really figure out that whole process. And then we'll come back to the Q&A. So let's get started. Denny.
Thank you, Ronnie, and good evening to everyone that had a chance to make it. I am Denny Dellwo, and as Ronnie said, I was a state legislator from the city of Spokane. And as a state legislator, I was appointed to be chairman of the House Health Care Committee. And as such, I was able to successfully begin a healthcare reform. And there was a cry in the state to make changes because healthcare had gotten so expensive. There had been an initiative mounted, and they almost got enough signatures, but they decided to wait and give us a chance to to prepare a healthcare reform package, and we did that. It was noted throughout one of the first state to adopt a comprehensive healthcare program. Just as an aside, I had the chance to sit down for tea with Hillary Clinton, who called upon Washington State to come in and give a talk because she was, as you know, very active in healthcare reform at the time. The problem was the next year election, we lost our majority and the Republicans repealed what we had passed. It's just sadness. Once I got out of the state legislature, I stayed in the effort to change healthcare and to upgrade it to what every single country except ours has, which is a single payer system. Every Western country, at least, and even some that aren't, have a better healthcare system that we have, mainly because we end up charging people. Bankruptcy is one of the biggest problems from healthcare. But anyway, getting back to this, I joined the Healthcare for All Washington and later became a member of the board of directors. And what we've been doing here is starting from the very beginning to develop a program where we would have a single payer system for the state of Washington. Healthcare, universal healthcare for the people of the state of Washington. We've made various proposals to the legislature. We haven't been successful, but we did this last year succeed in talking the state legislature into developing or appointing a healthcare commission, a universal healthcare commission, whose primary focus is on coming up with recommended changes to our healthcare program in the state of Washington. They had to include also a proposal regarding a single payer system. We, Washington, we support this as one of the key things that we can do, and that is support the commission in helping them move towards a proposal that can solve the problems that Washington State has had. And you can help us. This session is a short session. It's a 60-day session. We need to move fast. You can watch the legislation process on TV if you want. Channel 25 is a station that is a Washington State station that monitors all activities, both on the floor and in committees. They also record that so that you can get it at a later date and be able to review it. It'll be available for you. It makes it easier to testify too, because you're allowed now to be able to testify remotely instead of, like we are, 300 miles away, having to travel to the Capitol, to Olympia. The state also has a website, and this is a very valuable tool. It's, if you want to write this down, it's legwa.gov. So it's leg.wa.gov. And it has everything in there that you would need to be able to find out what's happening, what are the details of the bill, what the committee hearings, when they are, what's going to happen there, floor activity, and help you contact your legislator. Your legislator needs to know what you think. And surprisingly, having been one myself, you are really looking forward to your constituents coming from Spokane in this case, or from wherever you live, and talking with them. Many times they can't reach there, but we accept telephone calls, we accept letters. If they are from our constituents, we give them special attention because we are representing, in this case, Spokane, and want to talk to the people that we represent. If they're from other districts, you tend not to take the time necessary to talk with them. You either send mailings to them that can go out to many different people. So it's critical that you contact your legislator, that you contact them either in person or by letter. They also have a hotline phone where they have staff taking down your message and getting it to your legislator as soon as possible. It's existed for a long time and has been very successful. I answered every one of my calls, if not personally, by a message. But it's something that you can do, and it's very, very helpful in hearing from the people from your district. And so definitely take advantage of that. Before I start introducing Lonnie, or before I introduce Lonnie Johns-Brown, our lobbyist, I wanted to let you know how valuable she is to us in the legislative process. We as legislators or supporters need lobbyists. Most of the time you end up with organizations like ours, or like the poverty, or different organizations that don't have the resources to be able to provide legislators with contributions. But we try to raise money as we have done and hire ourselves a lobbyist so that she would be able to, in this case, do the work that we're not able to do. Lobbyists have the knowledge and ability to answer difficult questions and see what the bills get the best chance of succeeding. The legislator needs to hear from those affected, and she can provide that. It's something that the legislator himself or herself needs to talk with the representative from our organization, which in our case is Lonnie. But it's also good for us because she briefs us every week as to what's happening and what we need to do to make it more successful. At this time, we need your support, both personal and monetary. While we've had legislative success, this commission is what we're going to be dealing with for the next few years, because it is the one that gives us the best hope for the development of a single payer system. I'd like to introduce now, as our lobbyist, Lonnie Johns-Brown. Lonnie?
Well, thank you, Denny, and thank you for those kind comments. It's a pleasure to see you all. We are 3 days into a 60-day session, and this one is going to go fast. So while you're going to hear about a lot of bills that we're supporting, we are focusing our attention this year on 3 budget provisos, study provisos, each of which are designed to give us the information we need to start moving the needle towards universal health care and a single payer system. The process for provisos is not the same as it is for a bill. There won't be a hearing specifically on any of these provisos, but we have sought out champions. We have the provisos written, and these provisos will show up in the versions of the budgets that the House and Senate will do. We've seen the governors, and then they'll be part of that overall budget negotiation process. So I'm going to start with one of our provisos, and this one is one that's, I think, on everybody's mind. We benefited as a state, as did many states, by the influx of money from the federal government to expand Medicaid in a way that it actually allowed people to stay on Medicaid during the COVID crisis that might otherwise have lost that coverage. And since this past summer, we have been going through a process called the Medicaid unwinding. And what that highlighted for us was something we already knew was a problem, which was we do not have a particularly smooth process that really helps people that are losing Medicaid coverage get enrolled in programs at our health benefit exchange that are low cost or no cost, that they would qualify, because those programs have higher enrollment criteria. So what this proviso will do, our first proviso, will actually take a look at what California has done and what other states may be doing, and what our state needs to do, what tools we need to put together a system that will more smoothly get folks onto programs at the health benefit exchange that they don't qualify for Medicaid anymore. We estimate right now that we may have 300,000 people may have lost coverage in this Medicaid unwinding. So that's a lot of people that have lost insurance. And of course, our goal is get more people insured. This will also help us have a more seamless system for one of our other goals that I'm going to move to now, which is really unifying all the state healthcare programs that we have. We have dozens of different state healthcare programs. Our biggest ones, of course, are Medicaid, the programs at the Health Benefit Exchange, our public employee and state retiree and state teachers and state teacher retiree healthcare programs. I'm going to pause myself there and tell you that we have a champion for the continuing healthcare coverage, and that is Senator June Robinson, the chair of the Senate Ways and Means Committee. And that proviso is already written. So the other one that is really about unifying our system is a building on a former study to see how we can best mold together our PEB-SEB and non-Medicare retiree systems so that we can maximize our savings for healthcare, keep the cost of healthcare down. And there's several elements to that, including looking at standardized payments, combining them so that their benefits are uniform, and actually creating one huge pool of folks, which is pretty powerful when you're negotiating with insurance companies for what rates they're going to charge. And that one is the beginning of other steps we would like to take once we succeed at this, because if we can show the federal government that we actually have the ability to manage our entire state programs in a more unified and efficient fashion, that puts us in great position to be asking for waivers around Medicaid or ERISA and the other big hurdles that universal health care faces. The sponsor for that proviso is Senator Cleveland, who chairs the Senate Health Care Committee. And then the last proviso that we're working on is about expanding Medicaid for low-income, access to Medicaid for low-income Medicare beneficiaries. Many states have taken the option of allowing low-income Medicare beneficiaries to be dual enrolled in their Medicaid program. One big benefit of that is that will come with long-term care coverage, which for someone my age, that's a pretty big thing to know that you have the opportunity to have assistance with. We have that program, but it's a very, we cover folks only at about 74% of the federal poverty level. And so this study will look at what it would take to, increase that up to a maximum of 100% of the federal poverty level to begin. It would also look at something else that's very important, which is each of those folks is put through an asset limit review. And it's the only Medicaid program in our state that still requires that. We believe that's kind of a big waste of time since we know these folks are under 100% of the federal poverty level. So we have two sponsors for that proviso, Representative Theringer in the House and Senator Emily Randall in the Senate. So happy to answer questions later in the program about all of these, but these are all pieces that move us towards that goal of universal health care and single payer. So thank you for your attention.
Thank you, Denny and Lonnie, for getting us started. Now let's bring in Ron. And Ron, you're going to tell us about the Take Action Network, about a tool that people can use. But maybe for a second, you could show us the timing. Lonnie and Denny were telling us that that this is a short session. So the session started on Monday, January the 8th, but it does end on March 7th. So you can see cutoff days for new bills just less than a month from now, and then a last day to pass the bills over from the House to the Senate or from the Senate to the House for them to process it. And then everything will be ending by March 7th. So be aware, using the Take Action Network, like Ron will describe to you, can help stick or help us get this job done in the short session. So Ron, why don't you take it away? Ron has been a community activist involved in Virginia, where I first got to know him, in Florida, here in Washington State with League of Women Voters, several other groups. And he's going to show us some of the details on how you can get involved and utilize the Take Action Network.
Thank you, Ronnie. The Take Action Network is really a great opportunity to speak to your legislature and voice your opinion very quickly. It will give you connections to your legislators. As you can see, you have a directory. You can join the network. It lists all of those things. And here is the most important part of it for me. Once you're set up in the Take Action Network, this is my specific email notice that came in at 9 o'clock this morning of actions that I'm interested in. And you see, I am supporting Senate Bill 5775, cost sharing, and was able to voice my opinion in just a couple of seconds. I'm also interested in climate catastrophe. So the value of the TAN network is that it lets you very quickly voice your opinion as the bills move through the legislative process. Right at the time as the bills are being considered, you can send a message directly to your state representatives as you need to. So I'm going to encourage you to go to the link that I'm going to post in just a second in the chat and join up with the I'll get my screen right here. Here we go. Where you can actually join the Take Action Network. And then on a daily basis, if you need to, take 90 seconds, voice your opinion, and keep moving with the rest of your day. So Ronnie, that is the short message about Take Action Network.
Thanks, Ron. Thank you, thank you, thank you. And so look for the link in the chat for that tool, and that little toolkit that will come up. We will be publishing all of the deadlines that we see come up. So watch for that. If you can, sign up for Take Action Network. So now let's bring in Chelo Echeverria, who will tell us a little bit about how to personalize those statements if you do utilize the tools that are in the legislature's website, leg.wa.gov, or in Take Action Network, answering the messages there. Chelo, can you come aboard and share the tools that you've used in testifying and in talking to legislators individually or in small groups?
Absolutely. I think the thing that is the most important for me, that I found is the most important, is that making that human connection and saying why this legislation is important, not because it's politically correct or because it's an equity or through an equity lens, but really how it will impact you individually. And for that, I turn to my personal stories, and I will share with you 3 very intimate stories that one I will use in the future, 2 I have used in the past, to show the importance, to drive home the importance of universal health care, the fact that we are really suffering out here. So the first story is that my sister died of colon cancer. I'm going to name the insurance company. It's through the exchange. I have Molina Healthcare. I pay about $330 a month for Molina Healthcare. Because my sister died of colon cancer, I personally wanted a colonoscopy. And I was told that, first of all, no, I was just going to do the poo test. So I had to fight for that. And then secondly, when I got the colonoscopy, I actually ended up paying over $3,000. Because while indeed Molina does pay for the tools that do the actual photographs and scans up your butt, they don't pay for the bed. They don't pay for the hospital gown. They don't pay for the anesthesia. They don't pay for the recovery room. They don't pay for the hospital charges and surcharges. They don't pay for, the glass of water that you might have afterwards. And all of that. Oh, and if there is a polyp, nor do they pay for the removal of the polyp or the biopsy. So those kinds of stories can be very effective when you use them when speaking to legislators. A second story that I used once again about, and I have found like talking really about how, because I've had the opportunity to live overseas where I didn't have to worry about things like this. I have a chronic bad back. I lived in Istanbul, Turkey for 22 years. When I first moved to the United States 13 years ago now, almost 14 years ago, I didn't have health insurance for the first 3 years when I went back to graduate school because it didn't occur to me. Because I lived in a country that had universal health care. And my sister was absolutely appalled. She was like, oh my goodness, how can you live without health insurance? How can you live without health insurance? And my mom, who who was also a world traveler and who had been to Turkey many times with me, just spoke up and said, well, why would she worry about health insurance? She lived in a country that provided health care. So when you're talking to legislators, really think about those stories and how you can pitch them and use them to drive home the impact of the gaps of our healthcare system, the human impact of the gaps of our healthcare system. And that's all.
Thanks.
Was that
Thanks,
5
Chelo.
minutes? That was good, right? For time.
That was good. Thanks so much, Chelo. It's hard to share personal stories, and it's hard to bring up the big picture, the mission of, or the true values that we're looking for legislators to own or to share with us. So thanks for giving us some examples, Chelo.
Oh,
So,
I'm sorry, Ronnie. Can I just interrupt for 1 second more?
Sure.
Can everybody who's watching, can you please put any questions that you have in the chat so we can go through them all? Thank you so much.
So put questions in the chat. Be aware that we are entering the link to our website. Our website has changed recently. So if you have an old website bookmarked on your computer, make sure to change it. It's now just the abbreviation HCFA-WA.org. And so you can go there, add your questions in the chat, as Chelo just asked, go to our donation or volunteer spot. So now let's take a few minutes to do a kind of a quick run through on some of the bills we're going to be talking about, or going to be presenting and supporting as we go along. So Ron, you have a slide of several bills. If we could start out with Chris Currie, a volunteer from Eastern Washington, Marcia Stedman, another volunteer who is a former president of Healthcare for All. So Ron, if you could pull up that slide with the bill numbers on it, but you don't have to really grab pen and pencil to write it down now if you're going to be following either our website or the Take Action Network site. So be aware you can watch for that. So Chris, do you want to get started with Senate Joint Memorial 8006?
Yes, Senate Joint Memorial 8006 is a recommendation from the state legislature addressed to the president, the health secretary, and all members of Congress. And it specifies three things. First of all, it says it acknowledges that healthcare is a major issue, one of the most important issues that we have in the country, and that our system is in crisis. The second thing is that a national universal program is the most efficient and cost-effective way to fix the problems. And then the third thing is that it requests that the federal government create an affordable universal healthcare program. And since this is pretty unlikely in the near future, it also requests that the federal government, quote, partner with the state to reduce barriers and allow the state to successfully implement a single-payer health system, unquote. So the second thing that it asks for, the memorial asks for, is that the federal government pass HB 6270, which is the State-Based Universal Healthcare Act, as recently reintroduced by Ro Khanna from California. So this is actually the first memorial of its kind in the country to request these two things. There is a similar one in Maine, but we're the first legislator to request a universal national healthcare program and or the state-based Universal Healthcare Act to be passed. There are 125 municipalities across the country that have passed resolutions to support Medicare for all, but this is the first one to include the state-based Universal Healthcare Act. And one other thing is that one-payer states will soon have a petition out to that all of you can sign that's in support of the state-based Universal Healthcare Act, and we hope all of you will sign that petition. Thank you.
Thanks again, Chris. Sorry we cut you off trying to get organized. Marcia, you feel like you can share a quick round robin of these other bills? Basically, we want each, of our participants to be aware that these bills are here. We can't possibly do them justice, but Marcia, take it away.
I'll try. Hi, everyone. I'll be talking about 4 bills carried over from the 2023 session and one new one. First one is called the Keep Our Care Act, and this is to address the consolidation of hospital systems by merging and acquiring other affiliations. So it requires additional documentation to be filed with the Attorney General's office related to charity care, access to care, reproductive, gender affirming, emergency and end of life care, all their current policies and procedures, and explanations of how any of these would be affected by the proposed transaction. And it requires the Attorney General to determine through a public process if the transaction would have a detrimental effect on the continued existence of accessible, affordable health care for at least 10 years after the transaction occurs. And it does require public notice and input into proposed consolidations. The next bill is the called the Healthcare Cost Transparency Board 2.0, because currently the board has no authority to act against high-priced outliers. This bill would give the board the power to establish rules and collect and share more data, monitor and report on underinsurance, where patients may have insurance, but they can't afford to use it because of the high copays and deductibles. It will review profit and asset accumulation as a driver of spending, hold high-priced outliers accountable through public identification, performance improvement, and penalties when warranted. And it will study the hidden price drivers such as a nonprofit, quote unquote, tax breaks and out-of-network providers. Number 3 that is it already introduced is the provider contracting bill. It addresses the increasing consolidation in healthcare systems and their negotiations with health insurers. The problem here is that Washington's largest health systems are using outsized market power to demand higher payments from insurers, which in turn inflates prices for consumers without improving care. The solution here would place guardrails on anti-competitive behavior during negotiations between providers and insurers, so the competition can bring down prices for patients, workers, and employers. Some of these practices, anti-competitive practices, are incentives that favor certain providers or providers already affiliated with the health system, or hospitals with the lowest cost-sharing amounts. And then it would also direct the Attorney General's office and the Office of the Insurance Commissioner to study anti-competitive behavior. The 4th bill is the bill from Senator Currie regarding pharmacy benefit managers, or PBMs. PBMs, you may not have heard before, but because they are a hidden aspect of our healthcare system. This bill would regulate PBMs and require registration and contract filing. It would prohibit PBMs from requiring the use of a mail order pharmacy, except for specialty drugs, engaging in spread pricing, excluding a pharmacy from the network based on the time the pharmacy has been open, denying or reducing payment to a provider for a provider-administered drug if the drug was provided or secured from a wholesaler or pharmacy, and requiring a covered person to pay more than the PBM reimburses the pharmacy, or using personal information to solicit a covered person to use an affiliated pharmacy. Well, as you can see, this is a little bit complicated. PBMs are complicated, and there's much more information in the recording of our December 13th, Second Wednesday Speaker Series session, and we recommend watching the video on our website. I'll put a link in the chat when I'm finished with my presentation here tonight. Prime sponsor Senator Currie's comments are included in that video. Let's see, the discussion begins at the 5-minute mark. This bill is currently in the Senate Rules Committee, so we're hoping that it does get pulled to the floor soon. And then the 5th newer bill this session is Vichelli's Expanding and Protecting Preventative Healthcare Services from Cost Sharing. This bill ensures equity and access to preventive care services and would make our state consistent with the rest of the country in protecting these services from cost sharing. These services are spelled out in federal legislation as needing to be covered without cost sharing. And they are immunizations for diphtheria, hepatitis, influenza, and measles, children's screenings for lead exposure, oral health, vision, and autism, screenings for blood pressure, cholesterol, diabetes, and HIV, and for pregnant women, screenings for gestational diabetes, maternal depression, and preeclampsia. There's pre-exposure prophylaxis for HIV medications, and cancer screenings, including breast, lung, and colorectal cancer screening, and contraception for women. So this bill was heard yesterday in the House Healthcare and Wellness Committee and scheduled for executive session on Friday in the morning. So we're evaluating several more new bills. So watch for our emails and our action alerts. I just want to say that I agree with Denny and Lonnie. They mentioned previously that the legislature is moving fast, and our first action alert went out today. Please look for it and sign in pro today on these 3 bills that Ronnie will cover a bit later. The cost sharing for epinephrine autoinjectors, accessing an emergency supply of insulin, and protecting consumers from healthcare service charges for out-of-network ground ambulance services. Now, I'm thinking about the stories that Chelo shared. I would also like to say, if you have a personal story or to share, please consider also testifying in person or in writing at the hearing. You can sign up on the legislature's website. The action alerts that we have sent out to our members are for signing in, just signing in pro and not testifying. So there are other options you can use if you do have a personal story that is compelling and you want the committee to hear. So thank you very much.
Thank you, Marcia. Thank you. I don't know how you got all that out, but you covered it and introduced those bills. Now let's spotlight Roger Gantz to talk
Can I
about.
interrupt for 1 sec again? I'm sorry. Before Roger. The
What's that?
action, the website is in the chat. The link to the actions are on the chat.
Thank you, thank you, thank you. So let's spotlight Roger to talk about another new bill on balanced billing for ground ambulance. Roger, take it away.
Thank you, Ronnie. Again, my name is Roger Gantz, and I'm a member of the Policy Committee. I'd like to speak briefly on House Bill 2285 and Senate Bill 5986. These are companion bills that are bipartisan sponsored by our legislature to address ground ambulance balanced billing. I want to emphasize again, it's bipartisan because we have Representative Chelo, Representative Schmidt, R&D in the House side, Senator Cleveland and Senator Mizell on the Senate side, again, R's and D's co-sponsoring the bill. This is a bit of background for those that may not be aware. Balanced billing can occur when a provider or facilities have not signed a contract with a health carrier. They are often called out-of-network providers or facilities. These providers can bill a patient, for the difference between what the carrier paid and the amount that they bill the facility. That difference is called balanced billing, and individuals who use those services can be financially at risk of that. As an example of this, recently the Office of Insurance Commissioner completed a study on ground ambulance activity, and they found that on average, potential consumers, on average, can face up to $500 in balanced billing charges for emergency services and up to $1,000 for non-emergency services. So this has a significant impact. Washington already has been a leader in limiting balanced billing, and you can find that in something called the Balanced Billing Protection Act in our state laws. What these 2 bills would do, Senate Bill 5986, and 2285, would place ground ambulance services within the context of balanced billing protections. So among other things, what that means in real terms is that there would be a prohibition on balanced billing for emergency services provided to an enrollee. It would place restrictions on emergency healthcare performed by non-participating providers in certain facilities and ground ambulances. The bill will be Senate Bill 5986 is scheduled for a hearing this coming Friday in the Senate Health and Long-Term Care Committee. Given the bipartisan nature of it, we have remained optimistic that this bill will go forward, and certainly encourage you in your work and following through to support these 2 critical pieces of legislation.
Thank you, Roger. And those new bills are coming up soon, just as we've been sharing in the earlier comments from everyone. Roger?
First hearing is this Friday, and Senate Health and Long-Term Care Committee.
And so, thanks, Roger. If you could get rid of him for 1 minute, I will talk about the last two bills that we want you to be aware of. And it's two bills that Senator Kaiser has presented to lower patient co-payments or cost sharing. One is with epinephrine injectors, which are life-saving drugs. They have to be stored if a kid is at school and at home or at daycare or a grandparent or another caregiver's house. They need to have those auto injectors around. Co-payments are so high that it's been necessary for Senator Kaiser to bring forth a bill to limit what insurance companies can take from patients. So watch for this bill. We are strongly supporting a cap on those. We have found caps on insulin bills have been successful already to lower that copayment to $35. Lowering the copayment for epinephrine auto injectors to $60 will help save lives. The second bill is one number separate, so it's 5776, and it's to actually lower, not lower the usual cost payment through insurance, but to lower or to allow an emergency supply at a very low cost sharing amount. It would involve or it would require pharmaceutical manufacturers to support a 30-day emergency supply of insulin. So watch for the details about this emergency supply so that no one in our state will die from a lack of insulin. Anaphylactic reactions and the need for epinephrine are critical. Type 1 diabetes and the need for insulin are critical bills. So watch for those. As we go along tonight, please continue to enter your questions into the Q&A. We are kind of running over our schedule a little bit, but continue to enter those questions. We are entering the donate site or link for our website and a place where you can volunteer to help us get this more and more organized and a way that you can participate. And Roger, why don't you take us out of all these bills and really, Ron, if you could highlight and bring Roger back in, spotlight Roger one more time to talk about where we're going in this current year. We had some of these victories of little bills that can really add to our big picture. Roger, if you could just tell our listeners, our participants, what we're doing with these victories.
Yes, thank you, Ryan. So let me begin, if I might. I want to thank the Healthcare for Washington's Policy Committee and our lobbyists for their vision and hard work towards moving our state towards a unified financing system for all residents, as encompassed in our Washington Health Security Trust legislation as part of Healthcare for All. I also want to thank the Policy Committee for embracing what I would call near-term strategies. And by that, I mean, in my view, without enabling federal legislation that deals with both Medicare and ERISA, we are not going to be in a position to be able to integrate those systems into a unified system in Washington. That being said, to me, it points to the need to really try to emphasize what I would again call near-term strategies. And let me give you some quick examples of that. Again, last year, in our effort to try to support the Universal Healthcare Commission, we were successful in enabling to increase, nearly doubling the funding available to that commission to do their work and what we hope will be a much more timely time frame than they've been able to accomplish to date. Lonnie also went through 3 study provisos, and I'd like to emphasize those again, just for a moment to appreciate the importance of those. One is that Lonnie talked about an expanding Medicaid coverage for low-income Medicare beneficiaries. If that proviso study is successful and the legislature adopts that expansion, it could result in nearly 70,000 low-income Medicare beneficiaries having access to critical health and long-term care services.
I
Talked
had
about-
a Zoom meeting. I thought it was tomorrow. It's tonight. Yeah, it's almost done. Like you logged in late.
Hello? The second one that Lonnie talked about was this enrollment of and making a seamless relationship between the Medicaid program and the health exchange's qualified health plan program. We've recently seen where nearly 400,000 people that were on Medicaid lost coverage this last year through what we call the Medicaid unwinding process. Less than 10% of those folks found their way to health exchange plans that can provide subsidized premium cost-sharing coverage. Less than 10%. This proviso study that we're hoping to see enacted would provide guidance to the legislature to ensure that we have a seamless transition between those 2 programs and not see this loss of coverage. And finally, I'd like to say that the proviso study that Lonnie talked about with our SEB-PEB purchasing, they're bringing those 2 together. I think what we in the policy committee have seen is that can start and begin to build on a platform for all consolidated state purchasing, state agency purchasing, which represents over 40% of all people who are insured today. And our view would be is that platform can again serve as a basis. So when we're able to access the ability to bring in Medicare and ERISA plans, we have an operational platform to do that. And finally, I would like to thank you folks who participated this evening. It's through your dedicated work and support for us that we've been able to achieve the goals we have so far. And with your help in the future, we'll continue to be able to do that this coming session. Thank you, Ronnie.
Thank you, Roger. So we are running a little over, but let's take a minute to bring Peter in. So Ron, if you could highlight Peter to talk about how easy it is to make a donation if you're able.
Well, I'll go ahead and get started. I just feel really, really inspired and motivated by what I've heard tonight, and I'm gonna maybe get on the phone and on my email tomorrow and do some advocating. Over the past few years, Healthcare for All Washington has chalked up many legislative victories in Olympia. We were very active in the 2023 legislative session, and many of the progressive bills that we supported and lobbied for were passed. And if you want to get an update on our accomplishments up to this point, click on the legislation tab on our website. But in order to maintain our momentum, it is vitally important that we meet our legislators, grow our membership, educate the public, and mobilize our supporters to spread the word about universal health care to their families, friends, and most importantly, those in power in Olympia. We can achieve those goals through the hard work of our lobbyist, Lonnie Johns-Brown. Denny and Lonnie herself spoke about the value and the methods that she employs. In addition, we employ a communications specialist and are active on social media, conduct monthly webinars such as tonight's excellent presentation, and have meetings with civic groups. And we also host other events. Now, this doesn't come free. Financial support of our staff, including Lonnie, as well as our other activities and obligations, all require funds, which is why we are asking you to donate tonight and every month and all throughout the year. Our goal tonight is $300. Please go to the links in the chat or our website, click on the donate button. You can make a one-time donation, but we would especially appreciate it if you could make monthly recurring donations to provide support throughout the year. So please donate so we can spread the word and bring about universal publicly financed healthcare in Washington. And as you heard, we're making real progress, but there's still much to be done, and you all can help. Thank you.
Thank you, Peter. Sorry about running so late tonight, but if you do have questions and you put something in the chat, please make sure we have your email address. We will get back to you through email to answer those questions. I'm so sorry that we've run close to our 8 o'clock time. Thank you to all of our volunteers who have joined us tonight, to getting across the message about these bills, about the work that we're doing to support these bills. And there are a couple of other volunteers several other volunteers on our policy committee, Sherry Weinberg, who is the co-chair, and Emil Chang, Bonnie Kim, Elaine Cox. So thank you to each of them and people that made the program work tonight, just including Rich Legou and D.W. Clark. So thank you for your work in the background. And most of all, most especially, thank you to each of you for participating tonight and to showing that you're interested in this process, that you're willing to make democracy work. It's not easy and it's not a spectator sport. So your participation is critical. So thank you for joining us tonight. Thank you to all our speakers and to our volunteers in the background who made it work. And if you did ask a question in the chat, please make sure you've either given us your email before so we can link it with your name, or take a minute now and go back into the chat and give us your email so that we can get back to you with the answer to this question. In closing, we will be meeting again on the second Wednesday of February. It's Black History Month, and we are so excited to have Finetta Molson-Turner, a former Black Panther in Seattle, who is a retired nurse, will be joining us. Frankie Manning, a Army nurse who is retired, will be joining us. Several people from nursing schools in our state will help lead a celebration of the role of Black nurses in our community and of bringing up that issue and of meeting the needs that are so often overlooked and are one of the worst parts of our failure in our current health system. So please join us on February 14th for, I guess that's Valentine's Day, for our second Wednesday speaker series during Black History Month. See you all then. Thank you very much for joining us tonight.